Okay, I'm ready.
Okay.
You're on, Commissioner.
And 3, 2, 1.
Good morning. Welcome to the Board of County Commissioners check-in for Thursday, February 4th, 2021. It is 10:03 a.m. My name is Ty Menser, Chair of the Board of County Commissioners. We have Vice Chair Commissioner Gary Edwards, Commissioner Carolina Mejia, as well as County Manager Miro Chavez and Assistant County Manager Robin Campbell, and the head of our Public Health Department, Shelley Slaughter, and our County Health Officer, Dimiana Abdulmalik. And we often have kind of a more open forum for this, but in this particular Thursday check-in, we have two particular items that we're going to address. The first one will be the COVID-19 Vaccination Plan and some items in and around that. And then we will have an executive session later and this is a 90-minute block, later in the 90-minute block regarding a real estate issue. And so we'll make that clear when we're moving into executive session. So I think I'm going to ask the county manager, but I believe we're going to go straight into item 1 on the agenda, which is COVID-19 vaccination plan. Ramiro, I'll let you lay this out.
Thank you, Commissioner. There was a follow-up to the regular COVID-19 update that you get on that Tuesday morning. And obviously, sometimes that is not enough time for the board to ask questions, get perspective, considering right now what we're going through on the vaccination plan. Last Monday, I forwarded to the board the vaccination plan for Thurston County that was submitted to the Department of Health last Friday. I'm not expecting you to read that, but that will be the beginning of this briefing. Is for Shelley, Dr. Abdulmalik, to walk you through the key elements of what is included on the plan. And then maybe we can move into, really have a conversation on the supply of the vaccines. And that continues to be, my words, a pinch point. And also we'll move into the upcoming clinics and the mass vaccination sites that perhaps is part of this conversation. And as you may know, and all of you as board members have received many requests, as well as public health, for many individual groups that would like to host or entertain individual clinics, for vaccination clinics. So all that needs to be part of the conversation. And I figured that probably an hour, hopefully will give you enough time for staff to provide a perspective and for you to get any answers to the questions that you may have. Shelley?
Thank you so much, Ramiro. You framed that really well. I'm really looking forward to having this conversation with you today. I want to start with sharing some data and just where we're at in Thurston County in terms of our vaccination progress, as well as then highlight what the process actually is and what some of the challenges are we're experiencing that members of the public are definitely feeling the impact of. We're going to go into some detail about the vaccination plan, and our incident commander, Mark Moffitt, is here to talk about the details about some of our efforts and the clinics that we have been operating and that we plan to continue to do, as well as highlighting those really key community partnerships that we have. And I hope to answer any questions that you have along the way. I also have just a couple slides that I want to share with you so you can kind of have a perspective on how Thurston County is comparing to Washington State. So starting with the data, the good news is since I last saw you on Tuesday, the numbers continue to go up every single day. We are vaccinating more and more Thurston County residents, and that's excellent news. To date, 26,225 Thurston County residents have been vaccinated. That's the latest available data as of yesterday. 17,150 people have received their first dose, and 9,075 people have received their second dose already. So that's really great. So how does that compare to our statewide numbers? In terms of residents that have initiated the vaccination process, meaning they've sought out their first dose. 8.2 of Thurston County residents have done so thus far, and statewide, that percentage is 8.3%. So we're right on target with the state average. In terms of those who have completed their dosage, in Thurston County, we are at 1.28% of our population that is vaccinated. I know that doesn't seem like a lot because we have almost 300,000 residents to get through, but that's really good news considering that we've had very limited supply and we've been at this for just a little over a month thus far, and we know that's going to pick up rapidly. So 1.2% Thurston County residents completed, 1.8% statewide. There's also a dashboard that people can look at in the public. It's on the Washington State Department of Health website. And that shows this information that I'm sharing, as well as gives you an opportunity to see how our neighboring counties and communities are. And well, I know there's sometimes a perception because vaccine is so hard to get for people that want it. We have 70,000 residents that are eligible to be receiving the vaccine in phase now. And we've only had, on average, a few thousand doses available each week to distribute. So while that doesn't sound like a lot, and we hear other communities have some mass vaccination sites up and running, especially in our larger communities and the statewide operated ones, when you look at how Thurston County is doing compared to other counties of our size, everyone is in the same boat as us. We're all about the same. There is just not enough vaccine to serve the residents who need it as quickly as we would like. So I'm going to share my slides really quick, if I may have permission to do so. Can you see my screen?
Not yet.
No.
Not. Okay. Let me.
Shelley, while you're looking that up, can I ask Dr. A question then if you're busy?
Absolutely.
Dr. A, how many are we getting every week? Again, Shelley said so, but I didn't get that number. How many possibilities are we going to have for inoculations or whatever every week? It's a set number, it sounded like.
So unfortunately, it's not a set number. It has been increasing week on week. This past week, we had 2,400 doses allocated through the state program for first doses, and 2,300 doses allocated through the state vaccine program for second doses. So we're, as a county of our size, should probably be getting around 5,000 doses, but the State Department of Health is looking not just at population, but also breaking it out by facility type to ensure that a certain percentage is going to pharmacies, clinics, and hospitals. So it's a pretty complex calculation, and it does vary a bit week on week.
Okay.
I have a follow-up question with what Commissioner Edwards just asked. So you said we were allocated 2,400 doses for the first shot and 2,300 for the second. But the numbers, I mean, we heard were 1,500 and 800. Are those the numbers that are directly sent to public health, and then the rest are sent to direct providers, or how does that work?
You're absolutely correct, Commissioner.
Thank
So
you.
if I may add on to that just a little bit here, I think this next slide will be helpful in explaining that and our process a little bit more. Can you see my slide now?
Yes.
Yeah.
Okay, great. So this is from a Washington State Department of Health presentation they did for immunization providers yesterday. And what you can see here is part of what Dr. Abdulmalik was referring to. Our ability to get vaccine out in the community also depends upon all the providers that have been approved by Washington State Department of Health to distribute the vaccine. So you can see in Thurston County, there are 43 approved vaccine providers in Thurston County. Thurston County Public Health and Social Services Department is one of 43 of those providers. And then you can also see that in terms of how that compares to other counties in the state, of course, our larger counties have more providers, and that's really key to helping to get vaccine out. There is not a requirement in Washington state that you have to get your vaccine in your own county. Something else to note. If you look over to the left on this bar graph here, you can see the different facilities by type that are used to get vaccine out to the community, with pharmacies being the largest vaccine provider in Washington state. And there are federal efforts to increase that, to have more pharmacies able to distribute. And I know that's something that you were interested in, Commissioner Edwards, earlier in the week. You can also see then that our healthcare providers are small practices, our family practices, our federally qualified health clinics, and other traditional healthcare providers are the next largest group. And then right after that, third in line, are public health providers. So local health jurisdictions and public health departments have a really key role in getting out vaccine to our local communities. Even more so than hospitals. You see hospitals follows right behind us. So our hospitals are amazing partners here in Thurston County, and they have been doing, Providence specifically has done the lion's share of vaccines in our community thus far. They were the only provider that is able to store the Pfizer vaccine, although we have a lot more Moderna now flowing in our community, and they got their first allocation in Thurston County and have been a really key and wonderful strategic partner, and I'll share more about our upcoming partnership plans with them soon. But just wanted you to see that. And then overall, the Washington state plan for increasing vaccinations. And this kind of touches on the different categories that we're going to go into discussing here with our local vaccine plan soon. But I just wanted you to kind of see these different systems and the way in which we work together to get vaccine out. So our key partners are obviously our healthcare partners and our traditional delivery systems that we've talked about. The hospitals, the clinics, pharmacies. We have a lot of questions about workplace clinics, and we do plan to have workplace clinics and talk more about that, but that is a traditional vaccine approach. You know, when we bring our flu clinic to Thurston County each year to vaccinate people, that's a really common way to get vaccine into people's arms. The next part, the enhanced delivery systems, is really where a lot of our focus is at Thurston County Public Health and Social Services right now, and our focus of our county efforts. So it's the high volume community vaccination sites. We also do call those mass vaccination sites, our mobile vaccination teams, and our community-based pop-up clinics. We'll be talking more about some of those that we have planned. And then,
Shelley?
yes.
Shelley, could I just throw something out here that I want you to address, but I don't want to put it in the wrong perspective or where it is. We had a situation involving some of the schools, teachers getting vaccinated and some not, and a little bit of a rub going on. So the other commissioners know as much as I do about that, which isn't very much. Is there any chance that you could put that in as part of your presentation, how that may have happened or what happened or what went on that as you're going along somewhere?
Yes, absolutely. We will address that. And I think Dr. Abdemelik and I just communicated about this issue this morning. We became aware of it yesterday. So yes, happy to share that.
Okay, thank you.
Thank you. And that really is a relevant question to ask at this time, because there are a lot of people providing vaccine in our state. And what we have learned is that not all of that is necessarily being coordinated with local jurisdictions. And so we're finding out about things that other people are doing with the best of intentions in our county, and really trying to shore up so that Thurston County Public Health is the primary point of contact for providers in our community, which is a really huge role, but that's going to help with communication going forward. Washington State Department of Health has been a huge support supports local health jurisdictions, and they have been operating mobile clinics as well to targeted groups. And also, as you know, Governor Inslee approved 4 state-run vaccination sites throughout in 4 strategic locations in Washington state. They're supported by National Guard and other state and local resources. And you may have heard mistakenly that there was one planned for Thurston County that the state had. We've learned since then that that is a long-term plan and hope that there will be a mass vaccination site in every region of the state. But at this time, the mass vaccination efforts are really primarily led by local health jurisdictions and the community partners. So that's where we are at with that. And again, really trying to improve communication for when people are coming into our community and vaccinating our residents. We want to know about that. And it's also really important that the vaccinations are happening in phase, which Dr. A may want to expand on a little bit more. But I do want to go back to the process. So I gave you all these numbers and kind of who gets vaccine, but then what happens and what happens next. So how the process is currently working, because there's not enough vaccine. The federal government ships vaccination supply to states based upon population. They are also we are learning to do some direct shipments to pharmacies, still learning more about what that might mean for us here in Thurston County. But right now the process is they give vaccine to the states. The states then have the responsibility to allocate vaccine based upon the state vaccination plan and the governor's priorities to local counties and healthcare providers. So with those 43 registered providers that we have in Thurston County now, they have to meet standards and have their application approved. And then they have, once approved, they have an opportunity to request a vaccination supply on a weekly basis. Part of the deal with that is when you request vaccination supply, you have to commit to administering at least 95% of those doses within 7 days of receipt. That's really important. It's also really important that no vaccination is wasted and that vaccinations, while the supply is slim like this, has to be distributed in phase. So those are not local decisions. Those are not things that we can alter. So when you request vaccine supply, you have to know that you can get it out and meet that 95% target. So what happens is providers put in their order, and then that usually happens on Tuesdays. And then by Friday night, everyone receives what their allocation is for the following week. So essentially you find out were your wishes granted or not. For the most part, thus far, there's not enough vaccine supply in Washington state to fulfill all those requests for all those providers. So the state then needs to look and balance what communities have planned, what the priorities are. For example, this last week, vaccinations were directed to help to stand up and support the state's 4 mass vaccination sites, as well as increase pharmacies. And the other priority was getting vaccine to local health departments to focus on underserved populations. So because of that, this last week, we had providers in our community that didn't get any vaccine that they requested. Most got less than they requested. Our department had requested 2,000 vaccines. We were allocated 1,500 because we were one of those priorities. So we actually got the highest allocation of any provider in our county over this last week. However, as Ramiro mentioned in our Tuesday morning agenda setting, because we had another provider with an event planned, we needed to share our allocation so we could ensure that we're getting that vaccine out to our community. So that really changes, that can drastically change organizations and providers vaccination plans that they have for that week when they're expecting to get a certain volume of supply and then they don't. It also makes logistical planning really difficult for those that are trying to plan events, but really the greatest impact is on the people that are seeking vaccine, because we can't advertise clinics and we can't open up appointments unless we are assured that we have the supply to be able to serve people, because we don't want situations that have happened elsewhere where people are making appointments or standing in line and they run out of vaccine, and that's really disappointing and unfair expectations for everyone. So, but what that really means is it's a scramble every week, everywhere, not just in our county, not just in our department, but all across the state. People are really struggling with juggling this because our supply chain is not stable, it's not predictable, and there's not enough to meet the demands. So I'm going to pause there. I'm talking a lot. Any questions about any of that?
Yeah.
Okay.
Okay.
Start.
Am I first?
Go ahead.
Okay. So I have a couple of questions. You mentioned we have 43 providers, and I'm wondering how we came to that number of providers specifically. I know you mentioned you have mentioned previously that the list of providers waiting to be accepted is quite long, but I'm wondering, who chooses, how many providers we have. If that's increasing, does that mean we get allocated more vaccines? How does that work?
Yeah, sure. That is really based upon the provider themselves. So providers in Thurston County can choose to apply to Washington State Department of Health to become providers. So that we don't have any influence around that at our local health jurisdiction. So that's where we don't have a hand in that process. Someone who's a clinic provider, perhaps they run a family practice clinic, can decide, I really want to make sure that I can help to give out COVID-19 vaccines. They put in their application to the state, that the state reviews that and then accepts or denies that. So while we know that we have 43 providers who have signed up and been approved, not all have received vaccination supplies yet. So does that answer your question? There can be more providers. We hope there will be more providers. The goal is to have as many providers that can help to give out vaccine to our Thurston County residents as possible signed up for this program.
Hey, Shelley, one of the key elements of becoming a provider is just to make sure they have the infrastructure behind it to have adequate storage for the vaccine. Is that correct?
That is correct. You have to have proper refrigeration units, certain freezer units if you're accepting Pfizer vaccine, of which are very difficult to do. You have to be very familiar with the processes. There are a lot of details. It's not easy, especially with the vaccines that we are handling now. There are very, very specific requirements that you have to properly and safely handle, store, and administer the vaccines. Short time frames, lots of different things you have to have in place. It's not, I know we have many people that want us to get vaccine out into the community, and it's not like we can just fill up syringes and take them in a cooler and walk around outside. There's very, very specific ways in which that vaccine must be handled when you're going off-site with vaccine. And you have to also have the proper systems to get people served. So right now, I know there's an incredible amount of frustration from people that there's so much online systems in place for appointments. Because of the nature of COVID-19 and how it's transmitted compared to previous major vaccination efforts that have happened throughout the world, the physical distancing piece is so important to protect people from getting COVID-19 while they're waiting for a vaccine. And it becomes really important to make sure that you're staggering and scheduling those appointments safely and efficiently being able to get people through by having really good pre-registration processes so you can get people through quickly. So the appointment only system is really hard. It's necessary for COVID-19 vaccines, but again, we have a lot of work to do at the state level, and we're working on that at the local level, how to make sure that that is more user-friendly for people and that we have other ways in which people can get vaccine who cannot access technology.
I have a couple more questions. Sorry, Chair. My other question is, equity is a big thing for me, and I want to make sure that we are being equitable through this process. A lot of the appointments that I've seen that we've put up have been through an online or email system only. And last week, you provided a number where people could call in case they didn't have that email access. What other steps are we taking to make sure that we're being equitable throughout this whole vaccination process?
Yes, thank you so much for bringing that up, Commissioner Mejia. Equity is our guiding principle in our vaccination process. And Thurston County Public Health and Social Services has health equity as a core value. It is the essence of what our mission is. And our overall goal is that all residents in Thurston County have equitable access to COVID-19 vaccines in the appropriate phase in geographically diverse areas where they live, work, and play. The overall goal is that everyone has equal opportunity, and especially populations that have experienced great health disparities because of COVID-19 pandemic, as well as other factors such as systemic racism and other things that have impacted the health and well-being and mortality rates for our vulnerable populations. So making sure that our systems and public health, and that's really the space that we hold dear to our heart, is making sure that people who do not have access to technology, such as we're experiencing that a lot with our elders, that we have a way in which they do not have to navigate those complex online systems themselves, and we have a pathway and personalized support over the phone to help get them opportunities for vaccine, and that they're not left out of vaccine opportunities because of that. We also want to make sure that we are serving our houseless population, which is a vulnerable population, in the appropriate phase so that we can bring vaccine to people who cannot otherwise come somewhere to get vaccine. So that's one of our core values, is make sure that we have as a key strategy bringing vaccine to people, and then also making sure that we are serving our BIPOC and our tribal working with our tribal health partners to ensure that we're reaching all populations of our community, that we are going to these communities, that we are sensitive to what their needs are, that we have services available in multiple languages, and that there are no unnecessary barriers that we are putting up locally that we can control. And it also is very key, and I'm going to talk a little bit more about our partners coming up, that we're partnering with our neighborhoods, our community leaders, our nonprofit organizations, our providers in these populations and areas that have those natural connections. So that is a very long answer to your question, Commissioner Mejia, but I do want to clarify that because that is a core value of ours, that the clinics that we have offered and the vaccine that we have distributed thus far at Thurston County Public Health have been targeted with equity and with these equity principles in mind. So we have We have sent out mobile vaccination units to our adult family homes where people cannot come out and reach vaccines. These are often small businesses owned by immigrant families a lot of times that are caring for elders in our community. They're in 1A and they haven't been able to access all vaccine yet. So we've been partnering with Department of Health, with Emergency Medical Services, Medic One, and our own staff to go out and make sure that we're serving them. When we have held our clinics at Lily Road, of which we've had 3, we have another one tonight. We've had several out in the community as well. We are targeting those that have called us that need assistance, that have not been able to, unfortunately, win that lottery of hearing about, okay, there's an online appointment opening and it fills in 20 minutes. We have a clinic in partnership with Providence Health and Services, Providence Medical Group, coming up this weekend. Over 2,000. Mark, what's the number there? 1,056. I think that's it. 1,056 appointments filled up in 20 minutes, and that was just an online. And that we know is not an equitable process. Not everybody can access that. Not everybody's there at the right, at that time. People are working. People can't do that. So they're calling us. We're helping navigate and making sure that we have clinics and opportunities for those that can't reach those other online methods.
So with a follow-up for that, I know sometimes in the process of people waiting, sometimes they're able to get a vaccine somewhere else and they don't either cancel their appointment or they don't show up. And so what's happening with those empty slots? Do we have a wait list that we call people and let them know there's an empty slot, you can come now and get your vaccine?
Yes, we do have that. And we are reserving 20% of the slots for people that have challenges accessing, and just for that reason. We have people that sign up for clinics and that don't show up. We're also finding that with each vial that we get, we're able to get more doses than planned with the Moderna vaccine. So Dr. A has developed exceptional talent in drawing out an 11th dose out of every vial. So we are quite literally squeezing every single drop of vaccine that we can to get more people served. And so that means you have some extra vaccine at the end of the day. We are committed to zero waste ever. So that is very important to us. We're making sure that we have those call lists and that those are fair and equitable lists, so that people can come and get that vaccine, so that we don't waste it. Because once that vial is opened, it has to be used within 6 hours, and once drawn into a syringe, it has to be used within 60 minutes. So it's a very short time frame, and that has proven to be it's really challenging for all providers that are doing this everywhere. So, but yes.
I'll leave my seatmates.
No, go ahead. Go ahead.
But where can people get on the wait list? Is there a specific way to get on this wait list if people who are qualified but are having trouble getting an appointment? What is the way to get on this wait list or call list that you have?
It's really to call our 360-867-2610 phone number. That's the best way. We're exploring ways in which we can expand to take a broader call volume. There is also a 1-800 number that Washington State Department of Health is answering to help connect people with appointments and answer questions for those that have difficulty accessing. But that's our local number, and that's the local process that we're using. And so that's one way for that. We are not keeping a public waiting list that for everyone in our community, because we cannot manage a waiting list of 70,000 people. But what we are trying to do as part of our approach to reach those underserved populations is to develop partnerships with organizations and bringing the vaccination to them, to also have another way of addressing that.
Thank you.
Oh,
Taylor.
yeah, could I follow up maybe on a couple of those questions? So I want to make sure I get it right. So it's 867-2610 is that number?
Yes.
And I would encourage Dr. A to include that number in any articles or releases in the media. And the reason for that, she's the most read author in our county right now, I believe. So I think it'll be very important to do that. Also, you mentioned an 800 number, so that doesn't do any good, but the 800 number is. And so maybe include that as well to reach those folks that are somewhat limited. Okay, out of the 43 that are entities that are providing this service, it sounds like we don't get much coordination from the state as to who gets what and when, so that might be a problem. About a week or, I don't know, so back, we gave authorization from the board to sign contracts with whomever was going to be providing certain services. Are some of these 43 some of those entities that we have signed contracts with?
We are working on some of that. Let me try to, I think Dr. A could possibly chime in on this too. So out of our 43 approved providers, 21 of those are healthcare clinics, 3 are hospitals, 12 are pharmacies, and then there are 3 public health and tribal health clinics, including us in that. So that's the makeup of it. We do have a longstanding pharmacy MOU that we're working on or planning to update with our local pharmacies. But there is a lot, while we don't have that initial piece with them applying for application to the state, once they are approved, we know that they are approved. We know what their allocation is. Dr. Abdimalik is regularly looking at that, and we're trying to make sure that we're letting the state know when we see things that that are going to cause a challenge for our community, so that we can help to inform the way in which allocation happens to other providers in our community. And also, we have really tight working relationships with those providers. We have a weekly phone call with all the providers. It's facilitated by Dr. A, and we talk to the providers about what their challenges are, how we can support them, what their plans are for the week, and there's a very consistent and positive relationship with those providers. We're also, in terms of our mass vaccination plans coming up, which I hope to be able to touch on here shortly, working on establishing contractual relationships and MOUs with providers that want to join us in the larger community-wide efforts, rather than focusing all their vaccine distribution efforts within their own facility. And so taking their supply allocation and their staff and bringing it to help support our site in partnership. For example, we had a meeting with Providence this morning. We're going to be working on that with them over this next week, similar to the model we have for the drive-through testing relationship that we have with them, to help support ongoing mass vaccinations for 1 to 3 days a week at our sites coming up. And we're going to continue to work on partnering with other providers to do that. We also worked with our federally qualified community health center. So in our community, that is Valley View and Seymour. They serve low-income populations in our community, and we work closely with them to help reach underserved populations as well, and provide support for their vaccination efforts that they have planned, as well as we work together to expand vaccine in our community.
Okay, then a follow-up on that coordination issue. You were going to mention the school, how that all came about. Were you going to stick that in there somewhere so everybody knows that because they're going to hear about it, so might as well talk about it.
Sure, absolutely. I think Dr. A is best to speak to this particular one because she was really involved in this yesterday and today.
Thank you so much for the question and the opportunity to address this issue. The way the phases were designed by the state is to look at risk, both of risk of serious disease and mortality, as well as risk of contracting COVID-19. So we're currently in phase 1B, tier 1, and we're also continuing to vaccinate individuals in phase 1A. So phase 1A includes healthcare workers, and this includes folks that are responsible for quarantine and isolation. So the reason why I mentioned this is the folks, so the medical staff in our school districts and at our schools have qualified for 1A vaccine and have been issued vouchers. And individuals that are responsible for quarantine and isolation within the schools are also 1A and have been issued vouchers for vaccination. So that's the group of folks that have been vaccinated in phase. Educators that are age 65 or older or over age 50 and part of multi-generational households are currently in phase. What we learned yesterday happened was that another entity who had a partnership with some of our with some pharmacies within our county had the opportunity to provide a vaccination clinic at the site of one of the schools, one of the high schools in our county. The intent, as we have heard it, and we are currently still investigating exactly what happened, but the intent, as we understand it, was to vaccinate 300 to 400 educators in phase. So the goal of this program was to get educators over age 65 or over age 50 in multi-generational households as defined by DOH. What it seemed like happened was that a lot of the slots weren't filled with folks in tier, and so an effort was made to call people up, and that includes people that were out of phase, including some educators. We and the Department of Health strongly support the allocation framework and the phase guidelines. So to be clear, I know this has been asked in the past, when is it ever appropriate to vaccinate out of phase? And the answer is only in really, really strict conditions when every effort has been made to remain in phase. And so specifically what I'm talking about is we mentioned that vaccine is really hard to manage, and that once we puncture a vial of Moderna, we've got 6 hours to expend every last dose, or we can't use it. So sometimes, and this has not happened to us in public health, we've vaccinated, all of our extra doses have been vaccinated in phase. But what has happened at times to other providers is that you open that last vial and you don't, you're calling down your call list, you're doing your best to reach folks 65 or older, at folks that are in phase. And the choice is either to vaccinate vaccinate folks out of phase or lose the vaccine. This should not occur. So if you're getting 11 doses out of your vial, this should account for no more than 10 doses at any given event. Where it becomes problematic is when it's more than that. And so my ask of everyone in our county is to really, in the sense of fairness and equity for everyone who's taking on risks and is performing critical critical work in our county is to stay within phase, and we're working together with the State Department of Health. The other piece for folks to remember is just that we've talked a lot about the provider agreements that folks sign with the State Department of Health. One of those provider agreements is that providers vaccinate strictly in phase. And so when folks vaccinate out of phase, it can lead to significant reductions in vaccine allocated, or even, allocations to that facility could even be halted. If the framework isn't followed, and that's part of the provider agreement.
Okay,
So,
I guess I don't know as I got a good answer on that, but I want my seatmates to know what the allegation was, that some schools got it and some did not. That's the bottom line, and it had to do with coordination, it sounds like, and I don't think anybody's faulting Thurston County Public Health, I can tell you that. I've not heard that. Just that they were upset that there seemed to be a fairness deal. I don't know, something went on up in Seattle where a whole bunch of donors to some hospital, they got a vaccine and nobody else did. So undoubtedly things like this are gonna happen, but we do need to try and rectify that whenever we know it exists, and try to make up for, I think, like coverage for those other jurisdictions, because heck, the outlying jurisdictions are the ones that have the least ability to do the in-home learning because they don't have the internet connections and stuff. So, pretty important that everybody end up getting the same treatment at some time. So, I see our chair, we're only gonna go until 11, is that right, sir? On this topic, and then we have to go into executive on another subject?
That's not set in concrete, but that was the plan. So we have 11 minutes left.
Yeah, well, I'm going
cover
to let it go at this right now. I do have one more question, but maybe, sir, you have some as well. I don't want to steal time.
I'll just make a quick comment and hopefully a question that's super quick. My comment is just that Commissioner Mejia clarified something about the numbers for me, which I think it's really important because I didn't understand this on Tuesday. I think it's just a suggestion. I think 90% of the time, the community is most focused on the number of vaccines coming into the county. They don't really care whether it's going to public health or pharmacies or hospitals when they're trying to get a sense of the scale. So I'd be really clear about that, because the numbers that are coming to public health are a lot lower, and then there was a higher number, and I was confused Tuesday, and Commissioner Mejia obviously was too, because she asked a clarifying question. So I would just make sure that you're clear about that so folks don't get confused unnecessarily. My question is, do these providers, is there a financial incentive for them to do this, or they do it out of the goodness of their heart? I mean, why would they go through all this trouble? I guess I'm wondering, what's the incentive to get more providers? Are they getting paid by the federal government, or how does that work?
So no, providers are all losing money on COVID-19 vaccinations. Most are not even billing insurance for the visit. The vaccine itself is completely free, paid for by the federal government. There is no charge to the patient at all for vaccinations, but some who get the vaccine from their personal health care provider may have a provider encountered visit when they get their vaccine, in which that would be a normal cost of whatever that visit is. But I think really this is where the community is really coming together, and the providers that do this work, they really have their heart in it. Everyone wants to get past this pandemic and wants our life to go back to some semblance of normal again soon. And the organizations that have this as their core mission are really committed to doing this. And but again, this is not a money-making venture for anyone. This is, in fact, it's really, really challenging, especially for smaller healthcare clinics to be able to do it, which is why many of our partners end up leaning on public health, because they need they need our help to be able to take care of all these other details and reach the public and help support in other ways.
Okay, Shelley, why don't you move on to your last topic here? We don't have a ton of time, so say what you need to say, and hopefully we can get a few questions in before we wrap.
Great. Okay, I want to give Mark a chance coming up to talk about our mass vaccination plans. So I know everybody is keenly interested and excited for us to get a site up and running. Again, it's all very dependent upon our vaccine supply. At this time, in addition to our pop-up clinics and our mobile clinics and the public health clinics that we are operating for special populations and underserved populations, we want to help get vaccine out to the general public as well. And as we move into phase B2, there's going to be many more people and sectors in our community that qualify. And one of the best things that we can do to get a lot of vaccine into a lot of people at once is to stand up a large scale or mass vaccination sites. And we have been planning this in our department for years and years and years. You never can quite predict how that will look. And COVID-19 is certainly a little bit different than some things that we planned for, but we know what to do, and we have amazing experts and other county departments that are helping to make this happen. So at this time, we have South Puget Sound Community College planned as a drive-through site to be up and running in the next couple of weeks, and partners and volunteer organizations that will help us to stand that up, working with United Way to help on the volunteers, working with Providence and other healthcare partners to be able to handle staffing. We're also looking into Thurston County Fairgrounds as a site, not as a drive-through site, but as a large-scale walk-up site. And so working through some details on that. We do know that the goal of the state is that every county has a mass vaccination site and has funding to be able to operate one. We've been looking at two to make sure we could balance the geographic needs of our community. But we're considering at this point, based upon supply, starting out with the one site. We'd love your input on it. And Mark's been doing an amazing job running and organizing all these clinics as our incident commander. And I would pass it to Mark to just brief you on a few details coming up about the large scale plans.
Good morning, commissioners. I just give you what we've done so far. So we have, as of Sunday night, we had available about 660 doses just to public health. Those numbers may not jive with what you may have heard, but it's because of different allocations. But what I was able to use was 660, and over about 6 events in that week's time. We've only been in that business of vaccinating about a week or so up until Sunday. We vaccinated 667. Tonight, we will have another 40 that we will be vaccinating to use up our supply from last week. As Dr. A and Shelley have said, we have to use within that 7 days. We have to use our vaccine. So tonight we're expending from last week. As of Monday, we received 1,500 doses just for public health. However, as you heard earlier in this meeting, we had to help out with this mass vax, or not had to, but our partner did not receive their allocation. So we've transferred that dose that we expect to use on Saturday, this Saturday, to them. So I have usable for me about 500 doses this week. I've planned more events than I can actually use. So I had to cancel clinics because I don't have the vaccine. So I just want to emphasize that point. We're putting a lot of work into clinics that we can't do because we don't have the vaccine. So going forward, Saturday we do have we have a partnership with Providence and Medic One and EMS and Lacey, City of Lacey and Parks. I mean, it's a huge collaboration. We've been meeting for several weeks now, planning this event, and that's going to happen Saturday. And we plan on between 1,000 and 1,100 people to vaccinate in that day. Sunday, Super Bowl Sunday, we have another clinic that we're partnering with the Senior Center in Lacey. We plan on doing close to 400 vaccinations that day. And that's going to be an ongoing collaboration with senior centers. I'm talking to Brian every couple of days to make sure that we have this, so we have everything solidified with him and our volunteers that are coming in. And then as Shelley said, South Puget Sound Community College, I've had a team developing that site, what it is that we need. I have the plan. They briefed me on the plan for Fairgrounds and SPSEC last night. The SPSEC site isn't good for a drive-through. They've looked at many different options, but logistically, it's not really viable. Yeah.
SPSCC is the drive-through site that is good.
Oh, I'm sorry. I'm messing up. So Fairgrounds. Fairgrounds.
I was going to say, yeah.
Thank you.
Yeah, thanks for that. I just talk and I don't listen to myself. So Fairgrounds is not the viable drive-through site. I have a team working on that one, and they're gonna look at it as a walkthrough, a mass vaccination walkthrough event. So SPSCC though, that is great. We're partnering with SPSCC. We've done several walkthroughs with them, and our auditor's office, and because the auditor's office had done the elections there, so we're following a similar plan. And drive through there with great observation areas and logistics, and we plan on doing at least 1,000 people a day once we're at the height of that drive-through clinic. We're going to start a little bit slow just to make sure that we have all the logistics in place. We're also looking at other options around the county to make sure that we do have an equitable vaccination plan for people in rural areas. Senior Services is great to work with because they reach out to some of the mobile home retirement parks that we can start doing mobile vaccination clinics to as well. So it's a large vaccination wheel with many cogs coming out of it. We're not the only ones invested in this. Our partners have been great. I just want to emphasize that there's a lot of folks that we're working with to get these things done. We can't do it alone in the county.
Thank you, Mark. Questions for Mark, Commissioner Mejia?
I do, but I see that we're very short on time. So I'm going to ask a question that I got from a public member for Dr. A, a little side variation. So when we test positive COVID patients for variants, if there aren't any known variants here, is it because they haven't arrived, or is it because we aren't doing that level of testing?
So there are many different labs and different types of tests. Surveillance is occurring primarily through the state lab and through University of Washington at this point, based on my current understanding. And so for things like antigen tests, like the point of care testing, all of that, we won't be able to pick up variants. For PCR testing, there are relationships between like some of our other laboratory groups and those two, and University of Washington and our public health lab, with that are formalizing protocols for when we would be testing for variants and how that's specifically going to look. But yes, there's a combination of type of test, facility that provides the test, and the relationship with our surveillance laboratories that are actively looking for variants.
So it may be here, but we don't know it yet, and we don't test locally.
Thank you.
Wrap up?
Okay. I guess my concern is that everybody is doing their darndest to get this mission accomplished, if you will. And we're doing that for our community. The problem is it's going to be a slow process. No matter if we work all the bugs out or not, we're still going to use a lot of time between now and getting all those citizens that are concerned that they want to get vaccinated to get them vaccinated. So we've got a long time down the road before we're going to accomplish this mission. And my concern is that we never seem to talk about what citizens can do while they're waiting for the government assistance, if you will. They can only get the shot through the government assistance. but there are so many other things that they might be able to do. I mean, you know, obviously we're talking about masks and don't lick the doorknobs and all the things that will keep people healthy. But there are so many other things. I mean, it can be as simple as proper rest so you don't get stressed out. Your resistance doesn't get down. There are several different allegations that certain things may help in preventing this. And my concern is that we should get the word out to folks without exposing the county to liability, for an example, by promoting one thing or another, but at least get the word out as best we can. And for a government position, more so than what would be Thurston County's position, the state has closed down many, many businesses that are going to have a hard time recovering. And so they're taking dollars away from the private enterprise, if you will. And why is it that we can't even get more advertising on TV, maybe, or a specific channel to address all the concerns the citizens have, kind of an ongoing distribution of information, if you will. I'm sure the local TV channel won't like it, but what the heck, the business that's closed down, it doesn't like it either. So I think in a national emergency like this, I think the media ought to be required to allow enough time to get the public information out there to help them make good decisions to keep their loved ones and themselves as safe as they possibly can during this. And whether that means taking an aspirin every day and that's going to solve the problem or what, I'm not advocating any one thing. I'm just saying that we don't seem to put any emphasis on the preventative part other than the standard masks and distancing and that type of thing. There are a lot of other things that could come into play, and I would like to see some focus on that at some point, and I would hope you maybe would take that conversation back to your state counterparts when you're working with them. And then we're out of time again. I mean, that's just the way it goes.
Okay, I'm gonna call it into this topic. Thank you, Shelley. Thank you, Dr. A. Thank you, Mark, for what you guys are doing and the clarity of information. I'm going to be interviewed tomorrow afternoon about all of this, so this is all really helpful to me. And Shelley, have your phone nearby in case I need to text you. And I also have some meetings on Monday related to this, so hopefully you guys can help me back support me on that. I want to give the accurate information. So thanks, everybody.
One last comment, Commissioner?
Yes, Ramiro.
If you don't mind. Very helpful, and as Commissioner Edwards is stating, there is never enough time, and we'll continue to make the best out of providing the information the board needs. If there is a need to schedule another 1 hour meeting related to vaccinations, please let me know. We can certainly do that. And also, I just like to follow up to Commissioner Menser, my appreciation to everything what you guys do. I am, and I know how many hours each one of you putting on a weekly basis, on a daily basis. And I believe that from my point, I need to recognize that. It is not just the three of you, it's the army of employees behind that. They really are trying to do their best. And I do acknowledge the pressures because you and your staff has been responding to this emergency for now almost a year. And I understand the pressures. And I'd just like to express my sincere appreciation to you and to all your staff for everything you have done so far. It is difficult, it is challenging, and the issue will continue to evolve as we move along, so thank you.
And I want to express it's all said by Commissioner, or by County Manager Romero, but you guys have got a heck of a task, and thank you for all you're doing. I just can't express that enough.
Thank you so much. Thank you. That means a lot to us, Ramiro, and our entire department. So I know they're watching and we'll be sharing that. And thank you so much also to the board for your support. We can't do this without you, and we want to make sure that you have all the information that you need when you're talking to your constituents, to our constituents. So please reach out to me. Let us know if there's any more information that you need, and we look forward to having more conversations. Thank you.
Time flies when you're having fun or talking about coronavirus. Okay, thank you. We're going to move into our executive session at this point. I do see Auditor Mary Hall online. And she's a participant there. This is pursuant to RCW 42.30.110B to consider the selection of a site or the acquisition of real estate by lease or purchase when public knowledge regarding such consideration would cause likelihood of increased price. Building availability is the topic. Commissioners' action may follow. We'll be in executive session for 30 minutes. It might be less than that. Let's say 25 minutes projected, and then we'll pop back out to see what will happen at that point. Thank you.
Yeah, thank you, sir. Let us close the connection.